Hey guys, welcome back to Staying Connected, a podcast where I talk to other people about their stories with Vascular Ehlers Danlos Syndrome, which I have myself as well. My name's Cade, and today I have Jennifer with me to tell us about her and her son's story with vEDS. Hey Jennifer.
Hey Cade.
Hey, so thank you so much for talking to me today.
Yeah, I'm glad I could do so.
Me too. So you have a son, Cade.
Yes. Cade, yep. He is 16.
All right. And tell me about how it came to be that you found out that he had vEDS.
Yeah, so actually our story might be a little bit different than others, but I mean, I'm assuming over time this might become more common, people finding out about vEDS. So Cade, actually, we were doing genetic testing for other reasons. He was diagnosed when he was 2.5 with autism spectrum disorder, and is doing great right now. But as part of my job, I do a lot of work with researchers who are looking into the genetics of autism. And so I was just really curious about looking into genetics, and we've had his testing done multiple times throughout his life for different reasons. But this latest one a couple years ago was really more because the whole exome sequencing became more clinically relevant and available through insurance. And so we said, well, let's try it again. Let's see if anything shows up for the autism. And nothing showed up for autism, but we did get the incidental finding for the COL3A1 gene, and that's how we found out about vEDS.
So that was an incidental finding on like an exome mutation test for autism?
Yeah, it was the whole exome sequencing, so looking at all of the protein coding genes in the genome. So so it's been becoming a lot more common recently, and I think that may be one way that we might be identifying additional vEDS patients, going forward.
That's crazy.
Yeah, I was not expecting it at all.
Had you ever even heard of vEDS before that diagnosis came back?
I actually had not. However, I myself have like hypermobile spectrum disorder, so not an official hypermobile Ehlers-Danlos. Mm-hmm. And my son is super tall and super thin and has a lot of kind of Marfan-like characteristics, just physically. And so I was always wondering if there was a relationship between my hypermobility and anything that he was experiencing. And so I did, because we had a relationship with the geneticist from his various testings over the years, I did actually ask her about Marfan's at one point, which she did the clinical test and said, no, he doesn't have Marfan's. So I did not know anything about vEDS, but I kind of had something in my mind about Marfan's, at least.
That's fascinating.
Yeah.
So did you get tested yourself too?
As part of his whole exome sequencing, so what they do is they take the blood sample from both him and his dad and me, just to see what is different in the exome results. And so they were able to say that, his result was a de novo result, or something that showed up first in him. It wasn't anything that either I or his dad carried.
Okay. So how old was he when he was diagnosed?
So he was 14. Yeah, when we got the call from the genetic counselor.
And how did you handle that with a 14-year-old?
That's a really good question. Obviously it wasn't anything where there had been stuff going on with him medically that he was waiting for us to kind of help him out to understand. So basically, I did get the call from the genetic counselor. I work from home in my upstairs office, and I remember getting the call from the genetic counselor, and I knew the kids were getting home soon. And so as he was kind of relaying to me the information, I'm furiously scribbling down the information and Googling it. And then I just remember kind of like trying not to sob loudly, as I was looking through all the information, because it was totally unexpected. And I knew they were going to be walking in the door any minute. So it was one of those situations where you sort of are it was completely unexpected. I had no idea how to respond really, but I knew that, it wasn't something that I wanted to alarm him of, because it wasn't anything that was affecting him today. So I think we did have a little bit more time in that way to sort of try to process it, as parents, and figure out what level of information is something he needs to know right away, like something that affects his day to day, and then I think that in many respects, it's sort of trying to figure out what to say to be helpful, but not unnecessarily alarmist if it's not needed, so that he can kind of go on with his day to day and live his life, and but still get to the point where obviously he's going to be transitioning to adulthood soon. So he's going to need to be taking on a lot of that thought process in hopefully a manageable way.
And he's 16 now.
He's 16 now, yeah.
So at what point did you tell him, and how did that go? I know a lot of parents struggle with that.
Yeah, I think, so one of the first things is, okay, so what needs to happen right away? We needed to alert the school that if there were anything to happen, and as of that point, there had been nothing medically that had happened that would have clued us into him having any problems with vEDS. So it wasn't, that, if this happens again, make sure to do X, Y, Z. So it was, putting together a plan with the school. It was super helpful to get connected with Drs. Byers and Shalhoub at UW and get kind of our little medical passport that gave us more information about how to structure, with the school, how to put in an emergency plan. But then the biggest thing for him was he needed to get a medical alert bracelet, right? So we needed to explain what that was. And I realized they don't have enough medical alert bracelets that have the information on the inside of the tab. Because for him, he doesn't want to be broadcasting that necessarily to all of his friends, but he needs to have the information kind of on his person. He's at this point, he doesn't carry a wallet yet. He doesn't have a driver's license yet. So he's got to carry it on his wrist, There's nowhere for him to carry around that passport. So I think part of it is that. And I think our initial explanations really were trying to be a little bit more gentle about, talking, I think using words like rupture and any sort of words that would be more alarming, I think we tried to avoid at the beginning. Mm-hmm. But I think as he's getting older now, and understanding a little bit more, and me needing to emphasize a little bit more what the ramifications are if he doesn't follow certain things, then, we're kind of to that point about, needing to be more specific about what could really happen. But to date, really, he hasn't had any major complications. He did have a pneumothorax this year within the past couple months. So that was his first experience of being in the hospital and having a chest tube and, having to worry about, that this might not be the only time this ever happens. And
right.
So
how did that happen?
Yeah, so it was odd, just over a weekend, he was complaining of pain in his side. There wasn't anything horribly acute about it, but we went to see his pediatrician, and based on his history of vEDS, he sent him to the ER. If we wouldn't have known that, I'm sure he would have said, because he is so tall and thin, and a lot of that growth information, the growth of the, quick growth. He's 6'7" at this point.
Wow.
So he really grew fast. And so a lot of the, early on, if he'd ever have any chest pains or in his ribs or something, they'd say, that happens a lot with boys when they're growing, and possibly girls too. But, being a boy, they focus on that. It's probably just, some pain and some based on his quick growth. But based now that we know of the vEDS, they said, he's not exhibiting any major problems, but why don't you go to the ER just to get checked? And so they did the x-ray and went, yep, he's got a pneumothorax, his lung is collapsed. Why don't we admit him? So we wouldn't have, yeah, I mean, in that way, there are things that the medical system is watching out for.
Yeah.
That we're able to nip in the bud, and things not necessarily, hopefully, getting, severe before we end up presenting in the ER.
Well, that's good you had a doctor that really paid attention to what was going on.
Yeah, I mean, I think it's good. I mean, obviously, our pediatrician basically knew nothing about vEDS when we first started, but we were lucky that we have one that's willing to learn, that is looking into things on his own, and is really willing to say when he doesn't know something,
That's
and when we need to go to see the experts.
So you said Cade was a de novo mutation.
Mm-hmm.
So how did I know I've heard a lot that de novo mutations, like the pregnancies can be a little weird. So how was that with yours?
Yeah, I mean, it's interesting that you mentioned that. I don't know that I don't know that I thought his pregnancy was off in any way. The one thing, of course, hindsight is 20/20, but really early on, like within the first 8 weeks, I started bleeding, and it was the placenta was starting to tear away from the wall of the inside of the uterus, and at that point they said, well, you just have to wait and see what happens, when he was born, we did the ultrasound, their ultrasound process, and they found that he had bilateral club feet in utero. And then when he was born, we found that he also had amniotic banding. So, and again, they might know more about this now than they did then, but at least my understanding over the years, and at least from then, is that it's fibers from the inside of the amniotic sac that get wrapped around appendages. So the recurrence, is basically 1 in 10,000 births, because sometimes they get wrapped around vital organs or something. But his were wrapped around his fingers and toes. So he was born with several partial fingers and a few missing toes.
Wow.
Just from that, and he'd had some, so obviously he left the hospital with his teeny tiny little casts on his legs for his club feet, and then he's had to have surgeries over during the first year of his life to do some correction with his hands and feet and all of that. So at first, I thought, well, maybe all of that environmental insult early on in utero could have contributed to the autism diagnosis, but I was really surprised when I connected with the vEDS community, and it sounds like the occurrence of club feet and amniotic banding is increased with individuals with vEDS. And so whether there was something going on with the connective tissue in utero that caused all that to happen, I mean, some of those, if that is the case, then some of our questions are starting to get answered in some ways about why that all happened early on.
Yeah. They also think that the early birth might be connected too, but there's no research yet, I don't think.
Yeah.
Was he early? Was he a preemie?
He was 10 days early. His brother, who came afterwards, was 3.5 weeks early, and he has no vEDS or anything. So I always thought, after the first one, I thought, oh God, I didn't even have the car seat together 10 days early because my mom was always late with us. I'm definitely going to be ready 2 weeks before my next one. And then his brother came and 3.5 weeks early, and I always think just to make a joke out of me. And I definitely wasn't ready 3.5 weeks early for the second one. So, yeah, but he was a little bit early, but not
significant.
Super, super early. Yeah.
Okay. So you have another son too. Did he get tested for vEDS?
So he didn't. Oh, yes, he did get tested. So they thought it was extremely unlikely that he would have anything because nothing showed up in either myself or their dad. But just because of the risk of, potential mosaic presentation. So he did get tested and he was negative.
Okay.
So, and again, that was sort of they said, it's so unlikely that he has this, but let's test him anyway. And that was so stressful because I thought, oh my God, what am I going to do if he comes, it was just that worry. Like I knew he most likely was not affected, but you never know. So it was really relieving to hear that he was okay.
Good. That's good. Yeah. You had mentioned earlier when we talked that Cade had gone through, I think, 3 different rounds of different types of testing.
Yeah.
For the vEDS.
Right. Yeah. So early on, so because of the birth the birth of defects with the club feed and the amniotic banding, it just is part of like family planning advice. They hooked us up with a geneticist, and this was back in 2002. So whatever was available then, our major question was, is there something that we did, or is there something that would indicate that this is more likely to occur with any future children that we have, specifically the club feed or the amniotic banding. And so we saw someone, they did some testing, and to be honest, I can't even tell you exactly what testing they did. I'm guessing it was a panel that was associated at the time with similar conditions. And they, I just remember going in and them saying, this really is something that would be extremely rare to happen again. Like this is most likely would never happen. This was just a random occurrence. So that was sort of giving us an answer, not necessarily to what the cause was of Cade's issues, but more, is this something that we have to think about as we plan for future children? And then as he got a little bit older and I got more involved in just professionally, like where my career led me was trying to connect with researchers that were doing more autism research. A lot of that in my area was looking into the genetics of autism. And so we went back. I think he was maybe 8 or something, and I went back to a geneticist and said, is there any new technology? Is it worth going back and looking at other things, specifically now that we know he has a diagnosis of autism in addition to the club feed and amniotic banding. So at that time they did a panel specific to autism at the time, which was, Fragile X, P10. I mean, there were several genes that had been implicated in the diagnosis of autism then, which obviously now has grown leaps and bounds since then. And then the final time was a couple years ago when it was more of a curiosity. Like I had been working with a lot of these rare disorder groups that were associated with autism and neurodevelopmental disorder. And I was just thinking, technology is again progressed, bounds, maybe we would get an answer this time. And so that's why we pursued going through one more time.
So did you ever get any answers that you were looking for the autism stuff?
Not yet. And it's one of those things where I'm sure that what we looked at was the protein coding regions of the genome. So obviously there's a lot of the non-coding regions of the genome that I think in future years scientists will know much more about. So it's potential that there could be some answers there in the years to come. I think one of the things that is clear in working with because I work with a lot of groups in my other capacity, not vEDS related, is that, and especially as people get older, I think you get to a certain point where whatever you're dealing with, you kind of aren't necessarily looking for the same answers that you might have been looking for when your kids were younger. Mm-hmm. Whether you've kind of started to figure out how to manage life in other ways, or your focus isn't necessarily as much on why, as much as it is on what can we do to help, our child today with the struggles that they have now. Mm-hmm. And so I think, just in terms of later in life genetic testing, I'm not sure how much that's going to happen, like in the vEDS community for incidental findings for older individuals, for example, because they kind of, you start figuring out life in that way, I guess.
Yeah.
In a different way.
So you said that what do you do?
So I'm a project manager. I work with autism genetics research, basically, autism and other neurodevelopmental disorders. So we we run registry programs for data collection and biospecimen collection for different groups that have genetic variants that have been implicated in autism or other neurodevelopmental disorders. And so, and that list keeps growing and growing and growing. It's not even that it's just strictly autism, but a lot of the groups, so, if you have a variant in a certain gene, some people may present with autism specifically, some might be more epilepsy specific or other, neuromuscular challenges. And so each group kind of has, it's very much like a little microcosm of what we experience in the vEDS community, and a lot of the same challenges and frustrations and the need to reach out and connect with other people who have your common, experience, and figuring out, I know that a lot of stuff you are learning a ton on Facebook pretty immediately from the whole community. And so, that's very similar to a lot of the rare disease communities that we work with. And, but so beneficial, to have that network.
So how has Cade handled it? I don't know if he would be part of the Facebook group yet at 16.
Right.
And
he's actually very anti-social media, so he may not join very soon. He's not a big fan of social media, which is totally fine. I'm okay with that. That's one less worry that I have to have. But for teenagers, so he, I think he's been able to communicate to us pretty clearly about what information he wants to know and what stuff he's not ready to know about yet.
Okay.
And I think as long as he's, living at home and, kind of still a minor, and, there are certain things that we don't necessarily need to let him know. He's definitely not someone that's going to go out and Google vEDS and then be coming to us with lots of questions. I think he's in a space of being much more avoidant in that way, just trying to figure out how to handle the information that he's been given so far.
And is there anything that he liked to do when he was 14 that you had to stop him from doing, or how have you handled that kind of activity?
Yeah. Right. That's a good question. In a weird way, many people with autism, not all by any stretch of the imagination, but many have challenges with, kind of motor planning, or, so he's never seen himself as sort of a super athletic person. He enjoys going out and doing just kind of recreational type things, swimming around in the pool, but not competitively, or, so he wasn't really into sports teams that he had to bow out of, or any kind of rough housing. He's never been kind of he and his brother have never been tumbling around the house, in a way that I have to worry about holes appearing in the walls or anything like that. So in that way, I don't, I'm sure. But yeah, so I think in that way, it wasn't as much of a blow as I can imagine it is for some kids that are really into that are told they can't do it anymore. I think that there are some things that now that he's a teenager, and he, as all teenagers go through that, wanting to be independent with their parents and not necessarily want to listen to what their parents are telling him they have to do. That's maybe where we're running into some challenges about, daily care and things you have to watch out for, and then feeling like, okay, but you're my parent telling me this, and I'm going to say that I don't need to do any of that. So I don't know I don't think it's not horrible at this point, but I think it's probably it's going to be a source of frustration, for him. And I think the more in that way, the more he can. I'm actually really looking forward to some of the conferences coming up where there can be other peers that he can meet and align with. And so that way he's kind of hearing information from other people other than his parents. Because I think once you get into teenage years, that can be hard.
Oh, I imagine, yeah. Because, I wasn't diagnosed until my late 20s.
Right, yeah.
I can't imagine that if my mom was telling me to
right.
do something, and I'll be like, I don't want to.
Can't do this. Have to do this. Blah, blah, blah. Yeah, I know.
Yeah.
Last person you want to hear any of that from.
Right. So you guys are going to the Marfan, the annual conference.
Yes, we're really looking forward to seeing everybody there.
Yeah, I'm so excited for that.
Yeah.
And I think by the time that this episode airs, we will have already gone.
Yeah. I'm sure you will do a follow-up.
Yeah.
Follow-up about all the great things that we all learned. So, yeah, we're going to that one, and then I'll be at the Ehlers Danlos Society meeting in Nashville, but won't be able to bring, the family at that point. So, okay. But I think it'll be a good summer.
Yeah, Cade should be able to get together with a lot of people.
Yeah,
at that conference in Houston. Yeah. So that's awesome.
Yeah.
So, is there anything else that I didn't ask, or anything else that you would really like to share?
Yeah, I mean, I think one of the things that comes up, and of course this is in my other role, is sort of working in, designing and running registries for rare disease groups, is because every family and individual that's dealing with a rare disorder, and there are so many challenges just every day, not only just getting through what you need to do in the day, but dealing with doctors, finding information. I'm sure that the last thing that people have time to do is signing up for registries and filling out surveys and uploading medical records and all of that stuff. I just know from the groups that I work with in my other role, and then aligning with, talking to people at the NIH and the FDA and pharmaceutical companies and that sort of thing, is how important it is for the community as a whole to obviously share what we can over Facebook too, but also put it in like a registry format that's more structured. That's something that researchers can point to, whether it's in a registry or an official natural history study, like the UW group is running. Just getting the data in there, because the more it's amazing what I've seen with some other groups, just the amount of engagement from the community and the data that's entered and then subsequently used by researchers. It can just really springboard into, and I know a lot of I know there's been a lot of discussion already about what, pharmaceutical options are available or not available in vEDS currently. But even as we think about kind of next generation, or, as things progress, pharma companies, I mean, in terms of overall investment, I think showing that there are engaged people in the community ready to participate and give information, I think goes a long way to people, making decisions to invest significant amounts of money in progressing, progress in, research into the disease. And so it's like, I am in a position to see both sides of the coin. This point is sort of oh God, I've worked all day at work, and do I really have time to sit down for an hour and fill out more surveys? You know, but then on the other side going, oh my gosh, yes, look at the numbers grow, and people, now we have so many more researchers engaged. And so I guess just overall, just the message of the importance of, whenever possible in all of our crazy lives, trying to find that time, if you can, to contribute to any of the research is just so important to,
I
for
agree.
our community.
I am so excited for that UW natural history study.
Yeah, that's going to be amazing. And I think everybody's going to learn so much, because it's, and I totally get, I'm thinking about, my son getting older and even getting into young adulthood and thinking, is he going to want to be participating? How do I engage, not even young adults, but even as people get older and they're having to deal with things, and how do you see the value for you yourself in putting together this information? And hopefully the more information gets out there, it just keeps building and building and building until, kind of things sort of break loose and we start getting a ton more answers.
Yeah, I'm so excited for that.
Yeah, absolutely.
Well, thank you so much for sharing yours and Cade's story.
Yeah. Well, I really enjoyed talking to you.
Anytime. I love talking to you too. And thank you everybody for listening. This was Staying Connected, and this was Jennifer and Cade's story with vEDS. I have new episodes coming out on the last Sunday of every month. So be on the lookout. Subscribe to the podcast if you want to hear more, and we'll talk to you soon.